You can actually make your face more beautiful every single day. Usually, facial shape and proportions are blamed on genetics. Like, however you are born, that's the face you'll live with. Most people don't even begin to realize that things like nasolabial folds, the appearance of a double chin, or dark circles under the eyes, every single one of these issues can be the result of the improper structural positioning of a single bone in our face. And this bone is literally called the beauty bone. Medically, it is called the maxilla. That is the upper jaw. It literally supports the entire middle third of the face. This whole area. And today, I'll show you how this bone affects the beauty of your face. You'll be able to diagnose what position yours is in, and I'll give you a technique you can use to influence it and change its position. And I use this technique constantly on my patients. If how you look is important to you, subscribe to the channel and let's get started. Friends, let's start with how it influences things. Look at this picture. You see two different people. Take a moment to notice which person is more attractive, the one on the right or the one on the left. You'll notice one very interesting thing, that depending on how well developed this specific area is, the middle third, how much it projects forward, and how sharp and defined the jawline is, that's exactly how we can judge how attractive a person truly is. Because when both the upper jaw and the lower jaw are perfectly aligned in the correct position, meaning they are horizontally well developed, the entire face naturally becomes much more defined, significantly sharper, and far more refined. That is exactly what most people instinctively perceive as true beauty. See the diagonal? Here the line is, yeah, longer. Here it's in a more vertical position. So, the more the upper jaw is in a vertical position, the more this cheekbone and upper jaw area looks like it's sunken inward. Bags under the eyes can also appear right there. Chin appears, and the jawline starts to sag. And a double chin can also appear. Look at the anatomy once more. Here it is, the upper jaw, isolated. See? This is a large bone that essentially forms the entire middle third of the face. So in total, the skull consists of 23 bones, and the upper jaw is one of those bones. You see, it has connections with other bones. And what's important for you to understand? The thing is, bones have a certain micromobility. They can slightly change their position. Well, actually, no one is surprised why different people have different bites, right? Why do some people have straight teeth while others don't? It's all also related to how the upper and lower jaws are positioned. People go to orthodontists to straighten their teeth or whiten their bite. The same thing happens to the skull in general. That is, the bones of the skull can change slightly. If we look at this mannequin here, what do you see? Here we have the skull, the nose, and right here is the maxilla. It forms the palate, where the tongue actually rests. And this here is our lower jaw and the chin, right? The correct position is horizontal. So, if the upper jaw drops down, and for what reasons might it drop down? There's also the topic of breathing, meaning if a person breathed through their mouth without nasal breathing, then a vertical position of the maxilla forms. At the same time, there can also be injuries, starting from early childhood. If injuries occur in the occipital cervical zone, it can affect nerves, including the hypoglossal nerve and other structures, causing the lower jaw to shift inward and the upper jaw to drop as well. And there's also this technique called mewing, developed by an orthodontist, who says that due to chronically incorrect tongue posture, the maxilla can drop, taking on a more vertical position. And consequently, this affects beauty. And here's an example of one of the students. So, it's the same person. She performed the techniques. It influenced the maxilla to start moving forward, and a more defined jawline appeared immediately, meaning the face became more attractive. Friends, actually, working with the maxilla is just one piece of the puzzle on the path to preserving youth and beauty for many years. And if you are looking to learn a set of professional techniques for working with your face, get lifted and defined cheekbones, get harmonious face proportions, improve face asymmetry, then I highly recommend you my Maxilla program. You can access it via the link in description. There, you will gain deep systematic knowledge on exactly how you can effectively preserve and maintain your youthful appearance over time. We will work with maxilla bone, and as a result, you will look 5 years younger. And how can you measure what position your upper jaw is in? The first is the brow area, right here. The second point is right under the nose. The third point is the chin. So if all three of these points align for you, then that's the standard of beauty. If a shift occurs, well, here it's minor, from 180 degrees. See the angle as 165 to 175. That's also good. The larger your angle, for example, if it becomes 150 or 140, it means you have a vertical maxilla position, and so you have something to work on. So, ideally, you can bring it to 180 degrees so that the brow, nose, and chin are all in one line. If you realize your angle is smaller, or even if you just feel tension, have dark circles under your eyes, or nasolabial folds, then these are also reasons to perform these techniques. Pay attention to what influences this. You see, the tongue is in our mouth, and it has many muscles. And these tongue muscles attach to the hyoid bone right here, and to the lower jaw. Therefore, first of all, I recommend that you relax the hyoid bone. So we just take the hyoid bone and stretch it to the side. And to enhance the effect, you can press your tongue against the roof of your mouth. In general, with mewing, to constantly push the upper jaw up and forward so it stays in the right position, it's very important to press the root of the tongue to the palate. There. And this is the position the tongue should be in constantly. But due to muscle tension, it's sometimes quite challenging to properly position the tongue on the palate. So firmly press it upward as much as you can. And when the tongue is up, we start stretching its muscles, grab the hyoid bone, and pull it in different directions. While doing this, try to keep the tongue up. This way, we will be stretching the tongue muscles. And we do this exactly 30 times in each direction to make it much easier for the tongue to rest naturally on the palate. And throughout the day, if you monitor it closely, the tongue will act like a powerful piston, constantly pushing the upper jaw upward. But besides basic mewing, there are even more effective advanced techniques that I use in my own specialized face plastic method. And face plastica is exactly the method that changes facial proportions, which is what I teach on my Mind Body Face app. There is one technique for how you can influence the position of the upper jaw. I'll show you one very effective technique. For this, you'll need to wash your hands now, or you can put on a glove, and we'll do this technique lying down. Friends, to perform this technique, well, I'm using a glove, though you can just wash your hands. What do? We are going to push, essentially, the upper jaw forward. You'll need to place your thumb on the hard palate and do not press on the teeth under any circumstances. So, don't press on the teeth so they don't accidentally shift, right? We place a finger right here on the hard palate. And then another finger right here on the bridge of the nose. And I will, yes, slowly create a steady force pushing the upper jaw forward. You just need to create tension and hold it for 1, 2, or 3 minutes. Doing this every day is great practice for getting your upper jaw to move forward and lift up. Start doing this. It really works. There are significantly more advanced techniques I cover in detail in my professional courses, but this one is also incredibly effective. Now, lie down. Finger on the hard palate. And here, between the eyebrows. I can use my other hand right here to help apply a bit of extra pressure, creating tension, and an upward vector. Diagonally, I'm creating the tension. I'm sort of hooking the upper jaw and pushing it forward. You should feel the tension building up. You might even feel like your upper jaw is starting to move forward. Try to do this for 1, 2, or even 3 minutes every single day, while consistently keeping your tongue up. For basic work on the upper jaw area, this is actually enough to start seeing your very first results. If you want to learn even more about this, join my Mind Body Face app. I will teach you exactly how to work with the maxilla and all the other bones of the skull. Please comment on the results of these techniques. I'm Dr. Alice. See you next time.